Let's talk about handling sensory sensitivities when you are a pregnant autistic mama. Sit with me for a minute. I'm going to go over some really practical ideas for you, as well as talk to you a little bit more about the reality of pregnancy when you are an autistic mom. If you don't know me, my name is Kristen and I am a pregnancy coach. I work with mamas all over the world to enjoy their pregnancy, grow a healthy baby, and have the beautiful birth experience that they want. So today, again, we are talking about handling the increased sensory sensitivities that often come during pregnancy, and this is especially true for neurodiverse moms on the autism spectrum. You may have firstly, it's normal for all pregnant moms to have some sensory sensitivity changes, generally with taste and smell. Pretty much every pregnant mom notices that. But if you are on the spectrum, you may notice even greater changes. So smell may change, taste may change, like for other moms, but to an nth degree for you. And if that happens, I would recommend that you stick to safe foods, but pay attention to the nourishing foods. If you caught the video from earlier this week, I talked about that. Look at seeing what foods feel safe to you, but also are high in protein, high in nutrient density, because those are the foods that are going to help you handle other issues like nausea, fatigue, and that sort of thing, and also grow a healthy baby and stay low risk, which is definitely what an autistic pregnant mom wants to do, because it just means a lot less being touched or messed with or monitored during your pregnancy. So I would start by finding those foods, or if you need help with that, reach out to me. This is what I do one-on-one with moms. But you may develop sensitivities that are above and beyond that. For example, a lot of pregnant autistic moms talk about developing greater sensitivity to lights and to sound and to touch. And that is something that you want to be really cognizant of and consider how you're going to handle that. I would recommend that firstly, you notice both your triggers and your soothers. So you want to note what you're struggling with, and then you want to think about how you can handle those struggles. Now, if you're really overwhelmed, you may not be able to think about how do I handle this in the moment. So if you're really overwhelmed with something, what can you do? I would recommend that you seek somewhere that you can calm down. That could be, for example, a bathroom, like if you're at work or if you're at the doctor's office or the midwife's office, a bathroom is usually available to you. So go in the bathroom, lock the door, lock the stall. If it's a single bathroom, you could even turn out the light for a minute. Just take a minute to calm down. Another good place is your vehicle. Again, this is usually accessible to you if you're at work. You may not want to leave a doctor's office or a midwife's office to go get in your vehicle, but you could say, I need a minute to calm down. And then if you're at home, close the door to your room, go to your bathroom. For some women, it's helpful to curl up with your husband or partner and just let them hold you if that strong sensory input is soothing to you. So do something that gets your nervous system more regulated and gets you calmed down. And then get to a place where you think about this situation happened, or I've noticed this sensitivity, and this is how I'm going to proactively handle things. So again, having a place to go, or thinking about things like if being in the office is starting to get overstimulating. Can you work remotely? Can you close your office door throughout some of the day? Can you shift the way some of your responsibilities work? If you've got your children, what can you do? Can you take a time period during the day where you can shut the door and have some time away? Is there somebody who can possibly help you? Are there routines? Many neurodiverse moms benefit from having some routines in place so that you have to think less, so that you know, for example, I'm always cooking this thing and I'm always handling these things in the same way. And then know soothing strategies like can playing with a fidget spinner help you? Can having something heavier weighted on your lap like a blanket help you? And those are different things that can be helpful for you. And then the other thing that you want to think about with this is considering how these sensory things are going to impact you with your birth and also with your prenatal appointment, because oftentimes hospitals, doctors' offices, they're really unpleasant from a sensory perspective because there's a lot of bright fluorescent lighting, there's a lot of sound, there are often a lot of people around, and so you may want to think about that. Think about, for example, booking your appointments early in the day when the office is less likely to be crowded, or sometimes in the late afternoon. You can ask your doctor's office, when is it likely to be less crowded, and when are there fewer people. So those things can be really helpful to you. And then for your birth, I highly recommend that you consider doing a lot of birth preparation, because that will equip you to be able to handle much of your birthing time at home and minimize the time that you're at the hospital. And then when you're at the hospital and things are well established, you're less likely to be poked and prodded. You can also do a birth plan. If you are needing a birth plan or guidance on that, drop me a line or put a comment below and I can link you to my birth plan kit. But when you do your birth plan, you can do things like request no vaginal exams, no IVs, intermittent fetal monitoring, that sort of thing, so that there's just less poking and prodding. There's less touching overall. And you can also lay out things like you want to have dim lighting. If you have an official diagnosis as being on the autism spectrum, then you qualify, at least if you're in the US, for disability accommodation, and you could bring that up. I really need the lights to be low to accommodate for this. Now I think it's a fine line to walk, especially when you're mothering, if you want to disclose your diagnosis or not, because that's up to you. But you should know that if you need to, there are ways to make sure that you're getting accommodations that you need. But many pregnant mamas ask for low lights and that sort of thing, so you may not need to disclose. What you do want to do is be well prepared for birth so that you're able to work with your birthing time and request those accommodations, because if you're working with things nicely, the nurses are going to let you be. The doctor's not probably going to be there in the hospital anyways until right before you're about to birth, but they'll let you be, and they'll even become your cheerleaders. So that's a good thing to do to help with handling all the sensory stimuli during birth, is just be really prepared so that you can be in your room, the lights can be low, you can be focusing, have the door closed, and kind of shut everything else out. And of course, another obvious choice is to consider a birth center, or especially a home birth, where everything is on your own terms. And that would probably help with appointments as well, because you're going to just have a more home-like atmosphere where you're having your appointments at as well. And again, looking at routines, using things like planners, your phone calendar, and that sort of thing to help you keep track of appointments, paying attention to what time of day you're booking the appointments so that they work best for you. And then during the day, just understanding what your triggers are, and then thinking about ways that you can help minimize that and reach high levels of wellness for yourself so that your pregnancy stays low risk. Those things will all help you deal with the sensory sensitivities that are coming up during pregnancy. Again, if you would like one-on-one help for this, someone to strategize with you, or you just want somebody who's there for you every day of your pregnancy, that is exactly what I do with my pregnant clients as a one-on-one pregnancy coach. I am neurodiverse myself and have been through 8 pregnancies that way, so I'm happy to share strategies with you or just help you figure out what works for you, because it's going to be different for every autistic or neurodiverse pregnant mom. Reach out if you need help. Otherwise, blessings to you, and I will talk with you soon.